Good evening, ladies and gentlemen. I remember my humble self, Lucky, Dr. Drugs, and I have the privilege of sharing this amazing topic or presenting this amazing topic that has been plaguing a lot of us, especially those that are in the working class, the aged, and those that are affected by menopause and other hormonal issues. And it's none other than spondylosis. We're going to be talking about this as a continuation from the last time. So this is spondylosis, prevention and treatment, part 2. And I remain my humble self, Lucky, Dr. Drugs. And our table of content goes thus. So we're just quickly going to run through what we talked about before, the human bones and joints, osteoarthritis, spondylosis, signs and symptoms. Then we'll delve into cause and risk factors, diagnosis, complications, prevention and management of spondylosis, and then the main part of our conversation today, which is healing spondylosis possible without surgery? So we're going to find out today shortly, and it's going to be more of an interactive session. So let's stay back and enjoy ourselves as we enjoy the ride. Of course, we know that human bones are about 206 when we become adults and consist of calcium, chondroitin. Please let's take note of that. Of course, oxygen, phosphorus, hydrogen, and more. And we know that joints are connections between bones that link the human skeletal system into a functional whole. These are just a few examples of them. We're going to focus on the one in the middle today, which is the one that's called the intervertebral disc, found in the spine. Then we have cartilage. We know that cartilage has smooth connective tissue made of cells called chondrocytes. Let's note this word because it's related to chondroitin. We're going to talk about that shortly. That produce a large amount of collagenous matrix. And collagen is a biomolecule that is very essential for structural integrity in the body, even from the bones to the intervertebral disc to the skin and so on and so forth. But let's not also leave out hyaluronic acid or hyaline cartilage, which of course helps with the smooth gliding of bones at the joints. And of course, we all know that the paddings are mostly made of cartilage and all that. We're going to talk about that shortly. And we know that these cartilage pads the bones the way the bushings in the car or the bushings in our cars help us to prevent so much noise in the shock absorber area and all that. God is a wonderful designer, an amazing designer. So we'll talk about these and more shortly. This is just an example of what the cartilage or the intervertebral disc looks like. So cartilage often lack blood and nerves like the intervertebral disc of the spine. Hence, they heal very slowly. Sometimes it's as a result of impatience, but a lot of people make a lot of mistakes. We're going to talk about that shortly. And of course, we know that they function as paddings like shock absorbers and connect muscles, tendons, ligaments, the body structural support and reduce friction between bones and joints as is depicted here. This is what these chondrocytes or the cells that make up a major part of the intervertebral disc or the cartilage in the intervertebral disc look like, as well as other parts of the body. We all know that arthritis is the universal set of these problems, which is painful inflammatory disorder and or stiffness of the joints. Of course, spondylosis, as we all know, is a subset of arthritis. You can see what happens to people's joints when they're having things like osteoarthritis. And of course, its full name is degenerative joint disease, or another way we can put it is age-related degenerative joint disease. As you can see, this person here will be having some crackling sound as a result of the loss of cartilage in the knee joint. Of course, the two opposing bones begin to erode each other, causing a lot of pain, discomfort, stiffness, and so on and so forth. Then we also have the type that happens in the spine. We're going to talk about that shortly and its associated issues. But let's bear in mind that osteoarthritis is more on the weight-bearing joints of the body. We've talked more about this in the previous part. It's an example of what a healthy knee should look like on the left. Look here, you can see how shiny and smooth it is. But look at the right here, and this looks like what people used to grind corn in those days. Of course, hence the grinding sound people hear in their knee called crepitus when they move sometimes. Ladies and gentlemen, we have landed. Spondylosis is simply osteoarthritis of the spine, and its types are based on the affected region because we have the cervical region of the spine all the way down to the lumbar region, the sacral region, and the caudal part of the spine, which is also known as the tail. But let's bear in mind that the baptismal name of this issue is age-related degenerative disc disease. And that's why some people just shorten it to degenerative disc disease or DDD. If you look very closely, you can see that this spine is already beginning to suffer what we're talking about. Let's have a closer look. You can see that the outer ring is already being compromised and the softer inner portion is already squeezing on the sciatic nerve and also the nerve within the disc, hence the pain that a lot of people feel when they have these problems. Just to talk about cervical spondylosis a bit, I notice that oftentimes when I have patients, especially females, when they complain about sciatica associated with lumbar or lumbosacral spondylosis, that is the sensation that shoots down one or both legs, radiating from the back. That's kind of pain that radiates from the back, leading to unwholesome sensations or unwanted sensations like numbness, tingling, and all that. Remember that the neck is also structurally similar to the lower back, that's the spine or the spinal region or the lumbar region, because you see that the way the nerves get issues or compressed in the lower back, it can also affect the nerves in the neck that actually emanates from the neck region of the spine. Also, I also want to use the opportunity to just quickly look at this picture on the right here. We'll see that there are some nerves that are emanating from the back. We'll look at that shortly. As you can see, this is the lower back and this is the part of the neck. Just look at the similarity. You see how the nerves come out of the neck region here, causing cervical spondylosis and can lead to sensations in the hands, weakness, tingling, and all that, in the arm and hands as well. And we call that cervical myelopathic radiculopathy. Just forget the long name. It just means compression of nerves in the neck, leading to unwanted sensations in the arm. We can also have sciatica as a result of compression of those nerves, when they are compressed in the lower back region. The signs and symptoms of spondylosis, as aforementioned in the last video, you see that in the last health seminar on spondylosis, you will see that it's still the same kind of issues that are related to sciatica and low back pain, like numbness, tingling, burning and shooting pain, as well as reduced range of motion in the affected limb or region, loss of muscle coordination and balance, and generally pain. Causes and risk factors, of course, aging, obesity, diabetes, because sugar destroys collagen fibers. Let's take note of that. High blood cholesterol can hinder the flow of blood to the micro or the tiny blood vessels that are supplying around that area. Trauma or injury, genetics, menopause. That's why you find out that a lot of women within the age of 45 to 55 often complain about low back pain and sensations running down the leg. Lack of exercise is not left out, because we all know that exercise stimulates regeneration and rejuvenation of the joints, especially in the back, and of course maintains fluidity and counter stiffness and all that. In our health group, we do that every morning. Then jobs with high joint strength, loss of muscle strength, and supporting a joint, nerve damage, etc. These are causes and risk factors. Now, but let's just zoom into some particular causes and their relationship with spondylosis. You see, obesity significantly increases the risk and severity of spondylosis by putting extra pressure on the spine, joints, and disc between the vertebrae, which can lead to their degeneration and contribute to spondylosis, also accelerating their breakdown and leading to the development of bone spurs. Sometimes in some results, you see where they write osteophytes along the spine, further compressing nerves and exacerbating pain, ultimately causing pain and discomfort associated with this condition. In short, excess weight acts as a major contributing factor to spondylosis, development, and progression. Treatment of this condition may be a complete failure without weight management. A lot of people are going for surgery, compression surgery, are weighing 200, or you're weighing like an elephant, and you're going for the compression surgery, 50-50 surgery, a lot, you are wasting your time. Because as you're coming out of that theater, know that you may be a glorified customer. Then diabetes and spondylosis. Diabetes can worsen the symptoms. It's just basically as a result of those complications that arise as a result of high blood cholesterol or damage of blood vessels that supply that area. But let's not forget that we mentioned that sugar and collagen do not go together. If you look at patients that have type 2 diabetes, for instance, you see that they age faster because the collagen fibers in the skin begin to get broken or they have poor quality. So sugar generally affects the production and integrity of collagen fibers, which are very essential when we're talking about spondylosis, because we know that a very good portion of the spine or of the intervertebral disc or the outer ring called the annulus fibrosus of the intervertebral disc is full of collagen fibers, while the inner portion called the nucleus pulposus is often full of, guess what? Water. So you can see how collagen is very, very important. And in fact, it is when this collagenous outer ring gets compromised, then the inner portion bulges and squeezes on the sciatic nerve and other nerves in that area, causing pain that may radiate or shoot downwards to the nerve. You see? So diabetes can affect production and quality of collagen, a key component of spinal disc outer ring called the annulus fibrosus, potentially leading to their degeneration and increased susceptibility towards disc herniation, worsening symptoms and hindering healing. That's just a summary of what we're talking about here. Let's not even forget that diabetes causes diabetic neuropathy. That means the sciatic nerve that was even affected is also a nerve, and diabetes has the capacity to damage nerves. So you can see that the sciatic nerve is not even left out, because the diabetes can also damage the sciatic nerve and make things even worse. So how do we diagnose this condition? The symptoms, of course, have to be, you need to interact with patients to know the basic symptoms, to know where we're going to in the first place. The medical imaging techniques, we have MRI, CT scan, X-ray, and a whole lot of other ways that this is diagnosed. Doctor will attend to you in that regard. Now, the complication of spondylosis include, number one, sciatica, which is shooting pain that radiates from the waist down the leg. And that's just a layman's definition. Of course, chronic pain, paresthesia, those tingling sensations people feel at the extremities, impotence or sexual dysfunction, loss of body posture is not left out, muscle weakness, peptic ulcer disease is not left out. Let's not even forget depression and suicidal tendencies. Then we have economic issues. We all know what the economic situation is around these days. We hope that things get better. Loss of reflexes is not left out. Increased risk of falls, anxiety, insomnia, because who do we know can sleep with pain? Decreased quality of life, foot drop. But I had a patient that had this problem, was scheduled for surgery, and by the grace of God, with compliance, of course, discipline and consistency, the surgery was cancelled. We'll talk about that some other time. We'll talk about how that happened. Then we have difficulty walking or standing and decreasing mobility. Please, I always like to talk about this issue, because a lot of people out of the world, anytime you go somewhere, you see someone like this man and this table ready to massage or climb or grind away the remaining parts that is just left that we're trying to manage. Please, massaging too aggressively or deeply can cause micro tears in muscles and soft tissue, number one. Let's bear in mind that the sciatic nerve is already crying out that it's almost gone. And then you now use massaging to finish it via what is called a scissors effect. That is terrible, because the patient will definitely begin to have what? You may feel better that period. Patient may pay that period, but the patient may have just paid for what? more problem coming up in future. I've never met someone that had a severe case of spondylosis that went for massaging and came back after 3 days and said that the massaging made the person feel better. I don't think I've ever met someone like that because of the effect it has on the sciatic nerve. You see, there's what I call a scissors effect, and this can lead to paralysis. It can worsen the pain. Of course, because we're looking at, in fact, if you listen to the surgery, the name of the surgery that is commonly performed on patients that have spondylosis is called decompression surgery. So what do you do when you massage? You compress. That is the opposite. So that is that. And it can lead to complete damage in the wrong hands. Please and please, once you meet somebody like this in a massaging room, say they want to massage your spondylosis, please and please, what do? You run like a mad person, like run like that man over there, and you can see that guy is running for his life. Now, we can't talk about spondylosis without talking briefly about the sciatic nerve or sciatica. You can see this is basically how it runs from the lower back here and goes all the way down. But bear in mind that the sciatic nerve controls muscle function and sensation in the legs, including the hamstring, quadriceps, calf muscles. It also provides sensation to the skin of the legs, feet, and toes. That's why when people have sciatica, they feel that it is their village people that are at work. It is not the village people that are at work. It's not a witch or witchcraft or arrow or whatever people say. It's actually as a result of compression of the nerves from this part of the lower back here, which is called the lumbar region or the lumbosacral region. And you can see where it's traveling down to the legs. And this compression here begins to give those sensations that people often mistaken for other issues that are not. Sciatica is basically characterized by pain, that's shocking pain, numbness, tingling, or weakness in the lower back, hips, and legs. And it occurs when the sciatic nerve, which runs from the lower back, as aforementioned, down to the legs, is irritated or what? Compressed, for those that like to massage. Please remember what I mentioned, what I said about massaging and compressing the already compressed sciatic nerve, causing problems. Now, sciatica is a common condition, especially these days, and it occurs when the sciatic nerve, which runs from the lower back down to the legs, is irritated or compressed. So please, you can see the way this dog is biting this person's sciatic nerve. I wonder what will be happening to the left leg of this man in this picture here. Yes. Oh, beautiful. Now look at this person's hindquarters. You can see, yes, just as if we are zooming in through X-raying or having an X. Let's say we are Superman now. We're having X-ray vision, and we're looking through this person's gluteus maximus or buttocks. You can see that these sciatic nerves that are emanating from the lower spine can get compressed, and that's why some people tell you that if they feel the pain through their buttocks, they feel it through their buttocks, and it shoots down the back of their legs. Look at where it's going to. Can you see the thigh bone in front here? And look at where this thing is going, just behind. And that's why they feel it all the way down to their leg. So peptic ulcer disease, the reason why I talk about this is because a lot of people like chewing any little thing. They're already swallowing tablets, swallowing painkillers, analgesics, ibuprofen, and a lot of other things that do not work with spondylosis. They just give you temporary relief. But bear in mind that as you're swallowing those things without caution or without guidance from a trained health practitioner, peptic ulcer disease is around the corner. Oftentimes, people that have spondylosis have peptic ulcer disease. Just go and find out. Out of 100, you may meet about 70 or more have peptic ulcer disease. And it's a result of these analgesics that they take because of the pain that they're trying to relieve. Now, peptic ulcer disease is simply a sore or break in the inner lining of the stomach and the beginning of the small intestine or the lower part of the esophagus. But bear in mind that it's mostly caused by a bacteria we're going to talk about shortly. We also have duodenal ulcer, esophageal ulcer. That's when it happens in the esophageal area. As you can see here, this esophageal ulcer, duodenal ulcer is somewhere here. That's just after the stomach. Of course, then we have gastric ulcer. You can see this stomach. Watching that Helicobacter pylori bacteria, we're going to talk about that gentleman shortly, relaxing inside the stomach as if it is an invited guest, but it's an uninvited guest. So I don't know whether it's even watching television there, but that's the major cause of peptic ulcer disease. And we all know that gastric ulcer could be quite discomforting, and depicted here is often caused by the infection. It's often caused by infection by the bacteria called H. pylori. So these are the signs and symptoms: pain, stomach discomfort, anorexia, belching, bloating, vomiting and nausea, hematemesis, that's vomiting blood, weight loss, weight gain. In fact, that sounds funny, but guess what? When you eat sometimes, in some types of ulcer, the pain gets worse. So the patient avoids eating and begins to lose weight. In some other cases, the patient gets relief after eating, and hence the patient eats more and has weight gain. The former is gastric ulcer cases, and the latter is donor ulcer cases. Occult blood is not blood that is a cultist, but occult blood simply means blood in stool. That means the ulcer is actively bleeding. You understand? And sometimes it comes as melena or dark, terribly smelling to that is as a result of digested blood from the bleeding. Then, of course, insomnia, as you all know. Ladies and gentlemen, this is the bacteria that is responsible for about 90% of or more of cases of ulcer, and is called Helicobacter pylori. Please, let's just get something straight in the next 30 seconds, possibly. This bacteria does not respond to antibiotics the way it used to respond when our parents used to try to tackle this condition. It has become H. pylori Pro Max, and even the 2 weeks quadruple eradication therapy in most cases is not working. So if you have this condition, try to get a health practitioner that knows how to manage it, because a lot of people just kill the bacteria and leave the holes they have left open. And a homeless bacteria, a homeless Helicobacter pylori will just go there and do what? Continue from where the last person stopped. And some unfortunate cases, you find out that patients that are having tendency to bleed, you find out that this bacteria can drill and rupture a blood vessel there, and the person begins to bleed as if it's Kanayo that did ritual for the person. The person is now vomiting blood and money. It's not juju, it's just H. pylori that is causing this problem. So let's bear this in mind, because a lot of patients that have spondylosis are complaining of this problem as well. So let's just bear this in mind and note that if you have this issue, do not go back to the former medication that you took before and feel that it's going to work. Or you're now doing what I call a one-jet program that's going and coming and you're expecting a different result. It's wrong. Management madness is defined as doing the same thing over and over again and expecting a different result. So you can't do the same thing over and over again expecting a different result. You must have to think out of the box and find a health practitioner that can handle this matter properly. I have a video of this on YouTube, doctordrugz. You can watch peptic ulcer disease and you see suggestive ways one can handle this terrible disease that is killing people anyhow this period. Of course, prevention and management of spondylosis, as I aforementioned, weight management. If you are overweight and you are treating spondylosis, you are wasting your time. I'm 90% sure of that. Dieting is also very important because sugar is inflammatory. Physiotherapy, remember, I don't say you should go to those people that massage by climbing or dance atilogu or dance choreography on your back, saying that they're massaging your back. They will just destroy your sciatic nerve and the person becomes paralyzed. So please go to a health practitioner, go to therapists, physiotherapists, or chiropractors. Please, they are there for us to go and meet. Quit smoking. Avoid alcoholism. Exercise is very important, as aforementioned, because it battles joint stiffness and also stimulates somatic stem cell repair. We'll talk about that shortly. Then, of course, chemotherapy, rest and relaxation, chiropractic care, let me say bone arrangement doctors. Let's put it that way. And then surgery. That's the compression surgery or 50-50 surgery. Well, then we'll talk about that shortly. The use of appropriate orthodox medication, that's chemical intervention. A lot of people dwell on chemical intervention, but they have been having spondylosis for 10 years, 7 years, and they are still taking the same thing they've taken before. My brother, sister in the Lord, be careful. I'm not saying your practitioner does not know what he's doing, but if you are doing the same thing over and over again and you're expecting a different result, that is called management madness. You must have to know that that person that keeps giving you pregabalin, gabapentin, gives you ibuprofen in the past 10 years may not have your interest at heart. Need to go and search for another specialist that should know how to take care of your problem so that you don't get into trouble. Because those drugs do not do much for you. They only work for as long as their half-life. Do not use them without prescription or guidance of a trained health practitioner. Say that again. very important. Of course, use of natural pharmaceuticals to adequately prevent, manage, and reverse arthritis, aka spondylosis, which is osteoarthritis of the spine. And you will see that anything that you get from these natural pharmaceuticals belongs to you. They have no side effects. They may be slow in action, but we'll see how they work shortly, and you see how they have a very wide or high advantage in the management of this condition. So that the complications in management of spondylosis, delayed diagnosis, it will go, don't worry, just back pain. I carried something yesterday. Rest in the Lord, please go and check that back pain. Poor compliance, because patients keep taking the same thing over and over again, and they get bored and probably leave the medication because they're not feeling it. Sometimes they begin to go to spiritual houses. Laziness is another problem. Get up and exercise to save your life. Some people will say no. Old age is another problem because as people get older, one has to do what? Maintain themselves, because old age is not a disease. It just needs maintenance. Massaging, of course, we've explained that. That's just direct destruction of the sciatic nerve roots. Fake medication is another problem. Wrong medication is another problem, especially self-medication. Poverty. Poverty and spondylosis don't go together, my brothers and sisters in the Lord, due to inability to walk, because you can see that the spondylosis is preventing person from walking, and walking is leading to what? Poverty. And poverty is also worsening spondylosis because of inability to take care of the person. Oh my goodness. It's a cycle that one has to break up from. Then other health conditions like diabetes don't help matters. Poor health information and understanding of sciatica. Some people say that they stepped on something when they were in their farm and their back did come. That means they have put something juju for them. Please, it is not juju. Go and meet your doctor, because sciatica that emanated as a result of the spondylosis is what may be the problem. Work-related or social obligations that exacerbate conditions. Some people are sabinus. When they are in the church, they want to be everywhere at the same time. When they are in the function, if they are not doing it, it may get spoiled. And in the process, their back pain begins to graduate into sciatica. And that is how spondylosis graduates to sciatica, because they are not allowing their body to rest. Rest, once see that nothing will happen. The church was there before you, it will be there after you are gone. Or the show you are working on was there before you, most likely, and will be there after you are gone. So take it easy and do what you can and rest that back. Old habits die hard. They say fool at 40 is a fool forever. It's not an insult. It's just trying to say that old habits die hard, because lifestyles are difficult to change when people are so used to them. They have formed the habit. So smoking, sweet tooth, junk food, and all that, we all know will lead to destruction of collagen fibers in this annulus fibrosus here, and can lead to damage of the intervertebral disc, leading to disc herniation and all that. Self-medication, lack of specialized health practitioners is a country I know that's one of the highest exporters of health practitioners today. And I don't want to mention the name of the country, but God will help us. Economic challenges and high cost of treatment is not left out. There's a country I know that does not have healthcare structure or a healthcare system. You're in that country, brothers in the Lord, do not fall sick. Because even the people, the top politicians in that country are flying abroad to go and treat themselves. It's just like a native doctor telling you that he needs the blood of Jesus. That means that native doctor is not, the situation is critical. Just like a native doctor shouting blood of Jesus, the situation is already critical. So please, the people that are supposed to help those people in that country are flying abroad for treatment. What does that tell you? The wrong beliefs about sciatica, just talk about witchcraft or charms. Please and please, your neighbor did not do juju for you. It may be sciatica or spondylosis that has led to that sciatica. Thank you so much. And then chemical intervention. Now, we have a lot of things we use to help to keep the situation calm. But some people dwell on them and begin to use them on their own. Examples include muscle relaxants. We have some names there. Citalud is very important, very, very popular. We have the NSAIDs. Ibuprofen is popular. Celebrex is popular. Corticosteroids, prednisolone is there. We have the opioid analgesics. We have the oxycodone and all that. Anticonvulsants. Look at the class of what people are drinking every day. Gabapentin and pregabalin. Sometimes people drink these things because of spondylosis. I wonder if they are having convulsion. I don't know. But if you see the way they swallow these things, and yet they will all say the same thing, that it is not doing anything. Wonder why they are drinking it. I think you should go back and meet your practitioner if it's not working for you to change it, because these drugs, you really don't want to know about the side effects. Topical creams are not left out. Epidural injections, please and please, if anybody's injecting any steroid in your back, be aware of the consequences. Yes, you may enjoy your back and you may begin to feel that fluidity like Najin or Shakira, but bear in mind that that is a false sense of relief. So take it easy after you're giving that injection. I'm not saying you should not take your injection, but know that that injection is doing nothing for you. And if it contains steroids, go and find out that steroids may not be so amazing for the intervertebral disc. So people are even unfortunate. In the long run, it makes things worse. Oral steroids are not left out. Antidepressants, because of the pain and the insomnia and all that, people are giving all this as well. Oh, wonderful. These are side effects that are associated with what we just talked about. Look at NSAIDs that people chew like chin-chin, like ibuprofen, any little thing, they just throw ibuprofen in their mouth, like diclofenac potassium, like diclofenac sodium, just keep swallowing these things. Bear in mind that peptic ulcer disease may be your next door neighbor. Muscle relaxants are not left out. Look at their side effects over there. Corticosteroids cause weight gain and all that. Constipation is not far from opiate analgesics. Anticonvulsants lead to drowsiness and so on. Antidepressants lead to nausea, vomiting, dizziness, headache, fatigue. Increased risk of suicidal thoughts. Please go and verify the sexual dysfunction and so on and so forth. That is not to discourage us, but to also just to make us know that we have to comply to whatever our health practitioner has prescribed for us. Do not go beyond that, because all drugs are poison. Now, is spondylosis possible? Is healing spondylosis possible without surgery? That's an amazing question. But I'm not going to answer this question directly. Let's look at what we have from a common source or common sources. So what are somatic stem cells? These are cells found all over the body that have the ability to become any cell that is what damaged or affected in that part of the body within their locality. Hence, they are indicated in what? Healing the body. Ladies and gentlemen, listen and listen to what I have to say now closely. A lot of people take things like they say that they are putting something under their tongue. They say it's stem cell, or they are swallowing it. That is wrong. We don't have that technology yet in circulation where you can put stem cell under your tongue or your sublingual cavity, and then the stem cells will cross the barrier of the cells that make up that sublingual area into your blood. It is not possible. Now, the cells will not pass through those cells. So if you are listening to people saying that they are giving you stem cells, that they are claiming that they are giving you pluripotent stem cells, which are localized to areas like the bone marrow that differentiates into the different components of the blood and so on. But when a child is being formed in the womb, that's from the embryonic phase, then you have those pluripotent stem cells that differentiate into different organs of the body and so on and so forth. Well, we still have some in areas like the testes, where these pluripotent stem cells differentiate into the spermatids and all that eventually form the gametes, that form the single genetic material that is passed into the sperm. You understand? That single strand that later merges with the single strand of the egg to now fertilize. Yes, we have stem cells there, but you are left more with somatic stem cells. Let's just call them adult stem cells. That is what we have. So people tell you that they are giving you stem cell therapy and they are taking it and all that. It is not correct. You may be taking very high dose of antioxidants that cause DNA stability. It's possible that's what they have, but telling you that you are taking stem cells is not correct. Now, these cells are found all over the body, and they have the ability to become any cell. That means they are like your repair police, damage countering officers all over the body. God is amazing. That means they're even found in the brain, in the heart. They're found everywhere. It's just for them to be stimulated enough to do what they're supposed to do. The body has an amazing property, which is somatic stem cells. And this can differentiate and heal almost every part of the body. And that is what we should be focusing on, and not buying bogus things or fake things that tell you that if you put out your tongue, yes, they may work there on that mechanism, but it is not correct. I'm emphasizing on this now because I have a lot of patients that keep telling me that they are taking one thing or the other. They say it's a stem cell, they put it in their tongue. Have you even forgotten that when you swallow this thing, the hydrochloric acid in the stomach, if there are cells in that thing you're swallowing, the hydrochloric acid in the stomach will destroy those cells. Never bother to check that. So please be careful what you purchase and make sure you consult your health practitioner before you buy anything carelessly, or at least a trained health practitioner. We're not saying that natural substances don't work. That is where we came from. But please, and please, let's not get carried away. So the question is still, is healing spondylosis possible without surgery? We'll find out shortly. So I did some research in a very simple way, and I asked Google. Google now has AI. And I said, what are somatic stem cells? And Google says somatic stem cells, also known as adult stem cells, remember what I just said, are cells that maintain and repair tissues in the body. They are found in many tissues, including where bone marrow, skin, and the brain. They're everywhere. Now, the characteristics include what? Multipotent. That means the somatic stem cells can differentiate into a limited number of cell types related to the tissue they originated from. And they have this self-renewal quality because somatic stem cells can divide many times while remaining undifferentiated themselves. It's not amazing. This is what we are looking at here. It's there on Google. You can type it now or later and see for yourself. So I'm not the one saying this. It is what is there for everybody to learn from. Now, let us ask ourselves on that question. We already know that somatic stem cells are everywhere and involved in healing. Spinal vertebrae and bones and intervertebral disc have somatic stem cells. And we know that the spinal vertebrae, bones, and intervertebral disc have somatic stem cells. And we know that when we're talking about spondylosis, we're talking about intervertebral disc damage. Let's not forget, because disc bulge and all that is mostly involved. Oftentimes when we're talking about spondylosis, there are other parameters that lead to spondylosis, but this is often the case. You understand? We still have bone spurs or osteophytes and all that. But you can see we also have the possibility of the disc to slip, slide, that's all that. But mostly, this is what the problem is all about. Now, this information is vital considering that anywhere we have somatic stem cells, healing is possible. I'm going to ask us a question very soon. I want us to type the answer to that question in the chat room. Let us see what we think. So I also asked, I said, do we have somatic stem cells in the vertebrae? That is where people have that lumbosacral or cervical spondylosis. And Google says, yes, that is correct. The vertebrae, which are the bones of the spine, contain somatic stem cells, also known as adult stem cells, which are capable of what? Regenerating and repairing bone tissue within the vertebral column. Please take note of this. You can screenshot it so you can check on your own later. Then I also went further to ask Google. Oh, I asked that question twice just to be sure. Just to be sure. And Google says in another form that yes, there are somatic stem cells in the vertebrae called vertebral skeletal stem cells. These cells are undifferentiated and can differentiate into multiple mature cell lineages in the vertebrae. Please and please take note that spondylosis happens in the vertebrae. That's your vertebral column. So I asked Google again, because everybody has Google, right? Do we have somatic stem cells in the intervertebral disc? Google says yes. Progenitor cells with mesenchymal stem cells properties are found where? In the intervertebral disc. Let me repeat again. Google says yes. Progenitor cells with mesenchymal stem cells properties are found in the intervertebral discs. These cells can be found in the annulus fibrosus, that is the part that gets damaged before the protrusion of the inner portion of the nucleus pulposus squishes on the area that causes that pain that radiates from the back down the leg. They're telling you that there are stem cells there, right in there. And also the nucleus pulposus, that's the inner part that holds water. You know, I mentioned that water is a very key ingredient in the treatment of spondylosis. and the cartilaginous end plates. That means there are stem cells all over that area. Can you see? So what's the explanation? Google went further to say that these mesenchymal stem cells are a type of somatic stem cells that can differentiate into cells with similar characteristics to those of the nucleus pulposus, at the inner portion of that intervertebral disc that gets damaged in most cases of spondylosis. And these mesenchymal stem cells can help treat, listen, let me zoom out so that we will see it clearly. These mesenchymal stem cells can help treat intervertebral disc degeneration. Let me zoom out again. Let me read that again. These mesenchymal stem cells can help treat intervertebral disc degeneration, IDD, by replenishing cells in the damaged area, 1, promoting the generation of new cells, 2, inhibiting apoptosis or cell death. That is the Latin word for cell death. Stimulating endogenous cells. I always mention, please do exercise to stimulate healing in the intervertebral disc area and all that. I always say it in our health group, which we all, or most of us belong to here. Then also slowing down the intervertebral disc degeneration process. Ladies and gentlemen, I'm not the one saying this. We all have Google. Go and check and verify for yourself. So I also asked Google again because I had to keep doing this because this is, most people go here to get information. Google is nice when you have guidance. Don't just go there on your own so you don't give yourself high blood pressure. Now, can the intervertebral disc heal? And Google says yes. An intervertebral disc can heal itself to a certain extent, with most herniated discs improving over time without surgery. I'm not the one that said it though. As the body naturally absorbs the protruding disc material and reduces inflammation. However, the healing process depends on the severity of the injury and individual factors, and complete repair of a significantly damaged disc may not be possible. That means it may not be 100%, but if you have 99% or 99.999, I believe that is better than what I don't want to mention now. So the key points about disc healing, you can see it here. I've written there that the body has the ability to heal damaged discs by breaking down and removing the extruding disc material through the immune system. Through the what? Immune system. That means there's a class of white blood cells called monocytes. They are like the police that make sure that any cell that is not where it's supposed to be, even cancer cells, they attack the cancer cells and begin to destroy it. That's why when you see, when I have patients that have something like a stage 1 cancer, or patients that or patients that are having a cancer of the prostate or prostate cancer, stage 1, I always add something to improve their immune system. That has been amazing. So, ladies and gentlemen, I'm asking us this question, and I want us to type the answer in the chat, in the chat room there. Just type the answer for yourself. From what you have seen so far, can spondylosis be treated or healed without surgery? Based on the evidence, what do you think? So let's go and let's introspect, and from what you have seen now, tell us whether it's possible or not. I'm not saying you should disrespect your health practitioner, but we're talking about the possibility of healing on its own without surgery. So let's quickly go to the importance of natural pharmaceuticals, because we talked about that shortly. I want to emphasize on this because of the lower side effects or the lower risk of side effect that they have. They don't even have side effects in the first place. Now, they help to reduce inflammation in the affected spinal joints. Remember, inflammation is one of the major problems that lead to pain. They help to heal damaged nerves. Sciatic nerve is a nerve. They help to replace lost minerals like calcium and all that. They help to treat peptic ulcer disease that often occurs due to analgesic use and abuse. They help to provide essential materials for joint healing, e.g. collagen, hyaluronic acid. We'll talk about that shortly. They help to enhance production of extracellular matrix around the cartilage cells, chondrocytes, that's glycosaminoglycans, collagen, etc., etc. They help to protect the DNA from damage at the joints and bones, promote and improve muscle mass, enhancing posture and stamina, resolve sexual dysfunction, because I know some of us may have heard of caudal equina syndrome, where the extensions from the tail of the spinal cord begin to have issues. And of course, they help in weight management, as we all know that one is obese, treating spondylosis may wasting your time. Okay, I want to talk about these biomolecules. I want us to focus on the biomolecules and what they do. These are just what I use for my patients. I'm not saying that you must use Forever Living products, but Forever Living product has been here for about 50 years, that's half a century, and I've been getting remarkable results when I use them for my patients. So this is what I use for my own patients and get amazing results. I'm not saying that you must use Forever Living product. Now, Freedom contains chondroitin and glucosamine sulfate. Remember when we talked about chondrocytes? From the word chondroitin, we should know what they do already. Methylsulfonyl methane, the wonder molecule, is not left out. Then stabilized aloe vera gel, which is what? A somatic stem cell stimulant, adult stem cell stimulant, which is what you need. Ascorbic acid is not left out, and these are how the components in there assist. Yes. Then we have Move. This is more like an all-in-one package, or most in one package, or a lot in one package. Contains chondroitin, glycosaminoglycans, collagen, and hyaluronic acid. Let's bear in mind that hyaluronic acid is the grease of the joint. That's why when your legs are moving, you're not hearing them creaking, because that is nature's grease, and your body produces hyaluronic acid. In fact, even produces hyaluronic. Funnily, for women that love skin beauty tips, hyaluronic acid is amazing for skin health and skin care. It's a very important component of the skin. So it helps in joint fluidity as it greases the joint as a result of the presence of hyaluronic acid, as is seen here, and a lot of other things it does. Yes, a lot of people take calcium. I agree, we have all sorts of calcium, but bear in mind that these calcium salts can be mostly water soluble. We need something that will stay longer in the blood so that it can interface with the problem for a longer period, and that's why dicalcium malate is unique for problems like this. So Forever Calcium has calcium malate and also has magnesium, zinc, copper, and 1,2,5-dihydrocholecalciferol, which we also know as vitamin D, as well as ascorbic acid and all that. So these are all essential for production and protection of healthy bones, especially in the joints. As a bonus, it's also good for development and maintenance of healthy teeth, combats osteoporosis or weak bones, which often are associated with menopause. So let's bear that in mind. That's on the side. This Arctic sea is often used by patients that have high blood pressure and cardiovascular disease conditions and other lifestyle diseases like high blood cholesterol or hypercholesterolemia and all that, because it helps to reduce the risk of accumulation or coagulation or aggregation of cholesterol aggregates within the blood vessels that can lead to issues like ischemic stroke, heart attack, and all that. But guess what? The active ingredient, which is eicosapentaenoic acid and docosahexaenoic acid, also helps with reduction of inflammation and pain. Remember, we talked about pain being a very terrible factor. Of course, supports joint health, supports heart health, and of course, supports brain function and mood. Remember how painful and discomforting these things can be. Oh, we just talked about hyaluronic acid. Here it is. Hyaluronic acid is a protein that our bodies produce to lubricate and cushion our joints and muscles. It is nature's grease. And that's what it is. As a bonus, it also ensures adequate skin hydration, so it's amazing. So you can find that in Active HA. Then we have Nature Min that contains calcium and a lot of other things that helps combat degenerative disc disease. But let us bear in mind that copper has been known to be associated with prevention of spondylosis or age-related degenerative disc disease. B12 plus is not left out because that contains cobalamin and folate analogs, which help in sciatic nerve regeneration and rejuvenation, which is often damaged via spondylosis. Then we have the lotions, as I aforementioned. Do not massage, just apply. This is often applied in the daytime. This one that is methylsulfonyl methane or MSM is applied in the nighttime. Then we have raw collagen, as you can see. Remember, I mentioned that the annulus fibrosus is about 70% collagen. So if you are taking anything against spondylosis and you have omitted collagen, well, you should or may have to rethink that. We'll be talking about weight management. You can go to lifestyle modification and weight management by doctordrugz on YouTube, and you will learn a lot. Of course, weight management is critical in management of joint diseases like spondylosis, because overweight increases the wear and tear processes that worsen spondylosis, and so on and so forth. We have Garcinia Plus, which contains hydroxystric acid. These have all been explained. Hydroxystric acid hinders the conversion of carbohydrates to fats, and it's also a natural appetite stimulant. Let's just go down to what is called the Clean 9 program, which is a 9 days weight loss and detoxification program that is designed to systematically help us to reduce weight without the occurrence of rebound weight, and incorporates autophagy, which is professional intermittent fasting that helps the body to consume what it does not need, and a lot of that. But it also contains a measuring tape for evidence after doing that. So on this note, I will be leaving us with this. Bear in mind that this is not everything we need to know about spondylosis, but let us just bear in mind, in addition, that you are what you consume. Remember that excess weight did not appear from heaven. It was not transferred via Bluetooth. It was not transferred via electromagnetic waves or whatever. It was consumed by the patient. So nothing like that. Everybody in your family is overweight and all that. You are what you consume. And there is a constant battle between factors that repair and protect our bodies and those that break it down. So we also have to be what on the winning side. And let's kindly remember not to adjust medication and dosage without the guidance of a trained health practitioner. And also, prevention is better than what early detection. The choices you make today, like this young man about to enter into any of these 3 doors, the first door may be like eating too much. Second door may be drinking alcohol in excess and smoking. The third door may be engaging in good lifestyle choices and also weight management. So whichever door the patient enters in earlier in life will determine how he or she will be tomorrow. And of course, I'm talking about aging a lot, but please let's bear in mind that aging is not a disease. It only needs maintenance. At this point in time, I will say thank you so much for coming, and God bless. So on this note, I'll say thank you so much, everybody, for coming. Good night and God bless. Bye. Oh, see you on Wednesday. Yeah, that's our health business meeting. Yes.